So whatever you do, it need not be orthodontics, anything, whatever you do in your life, you have to just stick to what you like to do. So don't compare yourself with other professions and get carried away and say you are in the worst profession or something.
Are you ready to crack the code to your dream MDS college? Well, don't worry. In this episode of Tooth Talks Navigating Your Dental Journey, we are going to help you in the same. Well, let me give you a quick introduction. I am Dr. Ichita Joshi and I'm your host for this show. So before diving deep into this fascinating conversation that I have lined up for you, I would like to take a moment to thank Cuspyd, whose efforts make this show possible. So Cuspyd is an evolving edutech company which is putting in a lot of efforts to help dentists like you, and they are constantly working to transform the way in which dental professionals learn and grow. So in today's episode, we are honored to have here our esteemed guest, Dr. Rajesh Reddy, sir. Welcome to the show, sir.
Thank you.
So sir is joining us here to share his wisdom and expertise in the field of orthodontics. Sir has done his M.Orth from Royal College of Surgeons in Edinburgh in 2004, and Sir has done his MDS and BDS from Bapuji Dental College in Davangere in 2000 and 1996 respectively. Sir is also appointed as the youngest president of Telangana State Dental Council, and Sir has published so many papers and research work over national and international platforms both. Sir, you have been faculty of orthodontics for over 20 years. And you have been in Sri Sai Dental College for over 18 years, sir. That is really amazing. So, sir, to start off this conversation, could you tell our viewers a little bit about yourself and how has your experience been so far in orthodontics?
Actually, I wanted to become a MBBS doctor, but no regrets now after doing orthodontics. Once I got into orthodontics, once I was going through my BDS course, somehow I got fascinated towards orthodontics and had a fantastic experience. Loved the way I did my course, the way I treated patients. And I was under one of the best pioneers of Indian orthodontic personality. His name is Dr. Sadashiv Shetty. So he was the one who guided us through orthodontics. I still respect him. We are still in touch. And he's the man who's changed my life in dentistry to become an orthodontist. So I give all my regards to him or whatever, anything for him throughout my life. I was surprised that I would also teach, but that's still continuing. And now I almost finished some 21 years of my teaching. I don't know how long I'm going to teach, but yeah, till I can, I'll be sharing my knowledge to my students and my faculty or the next gen people.
Sir, that is really amazing how you are so passionate about sharing your knowledge with students and to helping them out. You have mentioned about your mentor, and we need mentors like you, like all of us dental students. So it's really amazing what you're doing, sir, and you should definitely continue doing it. We're looking forward to it. Sir, so coming to someone who has joined MDS, and they want to know that what all is taught in first, second and third year of the curriculum in MDS and orthodontics. And is there any difference between what is taught in a government college and a private college? So sir, what is your take on that?
See, firstly, when you're doing a course in India, it's the same all over India. Guidelines are given by the Dental Council of India and they need to follow that all over. But the teaching pattern in each department would be different. So there's nothing like they're going to learn less or learn more when it's compared to a government college or a private college. But it depends on their mentors and their teachers. They might change the pattern of teaching. It might differ from department to department. But what they're going to learn, the protocol is the same all over India. And you're talking about how it is separated in 3 years, right?
Yes, what is taught in the curriculum?
Yeah, like basically when the PG joins there, we have preclinical work for 6 months, which they have to brush up with the wire bending exercises.
Yes, sir. Preclinical work. It's definitely important.
Preclinical work where they rush through their BDS work, bit of BDS work, just to have the feel of the hands with the wire. There's something called typhodont work. Typhodont work is the thing where you have a artificial articulator where we have these wire bendings, we move the teeth artificially
Yes.
on a model. Then they go into the patient. So almost 2.5 years they're with the patients, and theoretically they go with the seminars, journal clubs and classes and all that. But mostly they are with the patients for next 2.5 years. It's basically a 3-year course. So 6 months they have a deadline to finish all the preclinical work and they get into the patients.
Okay, sir. So that gives us all an idea about what is there in 3 years of MDS in orthodontics, and I'm sure you will keep in mind while choosing the same. So, sir, coming to the next question, there is a myth, or people say that you need a huge investment when you are joining MDS in orthodontics. Like you need to buy expensive cameras and equipments and pliers and all that. So, is that so, sir?
See, probably our days, the orthodontic material was all imported ones. But now we have so many companies in India which have come up with different materials and different pliers and different kind of equipment that we really don't have to spend so much like what we used to do then. And see, when you're doing a post-graduation, you have a set group of PGs for every year. It can be 3 or it can. So they can share the cameras or the equipment, but the rest pliers, they need to have their own.
Yes,
So
sir.
it's not necessary that they have to buy an American one or a European one or anything. We are equally competent in India. We have enough material which is supplied and manufactured in India. So because orthodontic treatment is very expensive, people think that even the equipment is very expensive. So it's not that expensive. You can always buy it, and you can buy it stepwise according to their need in every stage of 3 years.
Yeah, definitely, sir. I think the investment is actually priceless when it comes to orthodontics. Those equipments, they hold no cost when it comes to the amount of learning that you'll get in orthodontics.
And these equipment, you can carry it throughout your lifetime. It's not that it's only used for your PG. You take it along with you, and you can use it in your private practice later.
Absolutely, sir. It's an investment for lifetime
Yeah,
and
exactly.
nothing else.
So yeah, like that, my first year, 20 years old pliers, I still use them in my private practice.
Okay.
Except 1 or 2, you lose it or you break it. Otherwise, you can still use it.
Yes. One more thing, keep your instrument safe in the department.
True.
So, sir, coming to the next question, what is the scope of research in orthodontics and how important it is for a PG student to focus on the research aspect?
See, basically, you don't have much of time when you are in your post-graduation because there are a lot of things to do. You have to study, you have to work, you have to manage your patients, you have to manage your records. There's a lot of book work, a lot of presentations. But research, if you're really keen, there is every postgraduate has to finish a dissertation, which is a research, supposedly. Whether he does a simple research or without that, they can't go give their post-graduation exam, PG exam. So I feel they should, depending on person to person, depending on how much they want to learn or how much they want to do a research thing, they can take up that particular topic and just go with it in those 2.5 years of their PG.
Okay, sir.
And if at all they want to do something more after post-graduation, if they can get into PhD, or there are many universities which are offering for PhDs, and even abroad, European countries are offering for PhDs and research. There are a lot of research centers abroad, so they can go there. We have few of our colleagues who have gone abroad and stuck totally into research out of practice. So it depends on person to person whether they want to make money or they want to, help the subject to go to the next level.
Okay. So that gives us a good perspective about it. And I think it's a mixture of both the things. I think obviously one wants money and also to contribute to the community. So sir, coming to the next question, I will talk this from the perspective of a BDS student. So if I'm a BDS student and I think that my handwork is not good, I'm not good at wire bendings, so can I still take up MDS in orthodontics?
See, absolutely. It's all about from where you learn, how you are taught. And the 6 months of brushing up with their wire bendings is to brush through your old things and learn how to. And they always think that, it's very tough. It's not that tough. You sit for some extra hours, you can get back into your normal bending. It's absolutely very easy. It's only a time-taking thing.
Yes, sir. Definitely requires a lot of time, patience, precision. But as you said, with practice, it will get better. So, sir, coming to another thing, that is clinical practice. So, what kind of cases do you usually get in clinical practice as an orthodontist, and does it vary as per your clinical experience?
People think orthodontists are only moving teeth, but it's absolutely not the same. It at early stage, growing stage, we correct the jaws, we correct the teeth, we expand the palates.
Yes.
We then later stage we put braces and we give it to a surgeon to correct the jaws. Different type of corrections with surgical corrections like correcting a small jaw, the upper jaw or the lower jaw. So orthodontics is just not teeth; it's about the face. And when you were combined with other departments, it's even more easier for us to do it.
Yes.
Like we combine with surgeons to do a surgical procedure, periodontists to have a better teeth. You all know that orthodontics, is the first specialty in dentistry.
Okay. Yes,
Yeah,
sir. I have
yeah.
heard about
and
it.
and it's been practiced for more than 100 years now.
That's a long
Yeah,
time.
yeah. So it started off with correcting the teeth. Later, it's not called orthodontics now. It's called orthodontics and dentofacial orthopedics.
Yes.
The specialty is just not orthodontics. Orthodontics is only moving the teeth, but when you combine it with dentofacial orthopedics, it's correcting the jaws too. So there's lot to learn, lot to study when you as a
Okay.
postgraduate, and it's very
Definitely,
interesting.
sir. Yes, sir. So I think you've busted a big myth that ortho is just about moving teeth. So as you all can see, it's so much more. It's like a holistic taking care of the human being altogether. So, sir, coming to the next question, since orthodontic treatment takes a lot of time, so it takes 1 year, 2 years, or maybe more than that. So if someone has a scenario in which they have to shift cities every now and then, maybe in a few years, suppose there is some family commitments or the spouse has a transferable job. So in that scenario, how will be the life of an orthodontist in such a case?
Now that orthodontists are just every city's got hundreds of orthodontists now, unlike before. And we have an Indian Orthodontic Society where we are all connected to each other some way or the other. So somebody is moving from one city to other city. There's so many orthodontists where either you know somebody or you get to know somebody from someone and you transfer the case to them.
Okay.
So it's very easy to follow it up. There's nothing like, there's any difficulty in that. They can always go, they can move anywhere in the world. We have Indians right now. So there's no problem at all. If they have to move, that case can be transferred from an orthodontist to another orthodontist. That's not an issue at all.
Okay, sir. So I think that again clarifies one of the huge doubt or misconception that people have. Moving on to the next question, sir. So now we hear so much about aligners, and how do you think that is changing the face of orthodontics branch?
Aligners are like, it's been a while that they have come in, but India, it's become very popular in this last couple of years. It's quite an expensive thing if you're talking about one aligner, which was started in the beginning called Invisalign. But now we have many companies in India which has made it much economically
Yes, sir.
cheaper. Personally, I feel all the cases cannot be treated with aligners. You have to be very selective, and that is where orthodontics plays a major role in that. People think that anybody can start doing aligners. That's what is happening in the city right now. But the main thing is the diagnosis. So that is where you are important as an orthodontist.
Yes, sir.
Whether you put braces, whether you give aligners, whether you do a surgical case, whatever you do, the diagnosis is important, and that is good for all the branches. You have to diagnose a case to treat it. So even if you're giving aligner, you should know what you're doing. So aligner is a good thing where people it's more aesthetically pleasing. It's more for elderly people. It is good.
Okay, sir. Yes, we hear a lot about aligners, but as sir you mentioned that nobody can replace an orthodontist. The orthodontist's valuable feedback and knowledge is definitely necessary in that case. So jumping to the next question, sir, what all job opportunities an orthodontist have in India or in abroad? So what all they can take up after they do MDS in orthodontics?
If you're planning to take up a job somewhere abroad, like Gulf area, somewhere in Gulf like Muscat or Saudi or anything, it is good enough. Most of them are there, and if you have to study further or if you are planning to go to US or Europe, I think you have to get back into DDS and then go again. So directly as an orthodontist, I'm not sure much about it, but As an orthodontist, if finishing orthodontics here and going there, getting into some school or getting into practice is not accepted there.
Okay.
You have to go through some exams and then. But if you are planning to go for a job, Gulf is the best option.
Okay, I will take a note of that. So we have got so many insights from you regarding the branch of orthodontics altogether. So I would say enough with the serious part.
Yeah.
Now I have lined up some fun questions for you. So I hope you're ready for the rapid fire round. So tell us, if
I'm
not...
a little tensed also. So.
Oh, don't be tensed. So sir, if not an orthodontist, what you would have been in your life as in the alternative universe?
I would have been a traveler.
Okay.
Traveling all the places. Maybe I would have gone to US to do something, some job. Maybe.
Okay.
I mean, because mostly in Hyderabad, people are fond of going abroad. Nowadays,
Yes,
it was a major thing that, for every family, somebody should go to US. So probably it was not, I was not keen on going abroad for my studies. Good, I'm settled down as an orthodontist, but maybe I like to travel.
Okay, it's really nice to know that you have a big travel bug in you. And that brings me to another question. So, something related to traveling and lifestyle, I would say. How would you rank the following? So, if I give you three options, one is money, one is work, and one is personal time. And I'll also add a fourth option for you, that is traveling. So, how will you order this in your preference?
See, you make money to have free time to travel. So all are interconnected.
And then you'll get personal time.
Then only
That's
you get
how it
personal
works.
time. So your travel is your personal time basically.
Yes.
So no money, no travel. Now it's become very expensive.
Oh, totally. I agree to that.
So all are interconnected. So, and the young generation, you think about everything.
Yes. Sir gave us a nice timeline on how to go about it. So, sir, coming to the next question, that is, what would you like to tell to your younger self, 10 years back? Any advice that you would like to give to your younger self?
So whatever you do, need not be orthodontics, anything, whatever you do in your life, you have to just stick to what you like to do. So don't compare yourself with other professions and get carried away and say you are in the worst profession or something. You have something in your mind that you want to do, please do it and enjoy it. When you enjoy it, you automatically get into it. You love it, and you won't get into depression.
Yes, sir. I will also take a note of that. This is something that even I personally needed. And it's really amazing to share all the knowledge and insights that you have shared with us. So that brings us to the end of this episode. Thank you so much for joining, sir.
Thank you for calling me and taking a small piece of advice from me.
No, sir. It was very valuable. So to our viewers, I would like to say that we want to hear from you. I'm sure you're following Cuspyd's YouTube channel. So if you're watching this video, do drop a comment below, and Team Cuspyd will get back to you with any of your doubts and queries that you have. And again, sir, thank you so much for joining us. We have a small token of appreciation for you.
Oh, you have a gift from?
Yes.
So keep calling me then.
Your presence here was absolutely priceless, and I'm sure a lot of students would be benefited by all the knowledge that you shared with us.
I always love to share my knowledge. That's what I will start with by my boss.
Really honored to have you here.
Yeah,
Thank you once again, sir.